I honestly, I don't even know where to start. I am officially wrapped up with week 4 of psych, mental health, nursing, my third semester of nursing school. And I was supposed to update myself after week 1. I blinked and 4 weeks went by, if that makes sense at all. So yeah, I just wanted to share kind of like what I've been up to, what's been happening with school in specific. Again, I started school Monday, August 27th, and my schedule did change on Monday, August 27th. We got notified by my professor 5 minutes before class ended, 5 minutes before our end of the day. The way our schedule was set is that we had theory and then seminar on Mondays, and lab was going to be on Thursdays, but she decided that, well, she already had a lab group coming in for Mondays, and why have to come back on Thursdays if we could just knock it out all the way on Mondays? So we switched and stayed that day, and from then on every Monday we've been staying. And honestly, it was so much better this way because there is not much to do in lab for psychiatric mental health, because a lot of it is therapeutic communication, and with that you really just have to go off of scenarios and practice your communication and practice the different kinds of ways you can be therapeutic, different questions you can ask to get different kinds of information. And really that just comes with practicing in the actual clinical setting / practicing with our peers, but there's not much hands-on lab work that we can do in lab. Mondays we're there from 7 a.m., which is when lecture starts, until about 3 or 4 p.m. depending on the day, and it's been nice because we just knock out all of our classes out of the way, and then Wednesday we go to clinical, and then we're done for the week. So it's been really nice. I do like that schedule, but I know that we only have 1 more week of that schedule, and then we're switching gears again because we have med-surg coming up, and I'm so excited. I just wanted to get here. I just want to pass mental health and go straight to med-surg, because that, what I hear, is the most intense and the most difficult, and we're also like anxious to start because we just want to get into our groove. But it has been nice to get into the movement of studying and just really focusing, and we're very animated and motivated right now, but I know that as the weeks go by we start getting a little burned out, and so that's what I'm in fear of. So I'm trying to find ways to keep me like motivated, keep myself amped up, and keep my energies high. So yeah, that first week we got that curveball thrown at us that our schedule was going to change on the day that it changed. And then we went to clinical, and that was really nice. We had like orientation for the first few hours, and then we went out on the floor and we were able to attend some therapy sessions and talk to patients. And so that was really interesting because honestly it's not like in the movies at all. And I know we shouldn't base our clinical setting off of movies or off of what we see on TV or what people have said in media, but I did, and I think all my group members did, because at the end of our day we were like, this is nothing like we expected. Like nobody expected it to be that structured, that clean, and that awesome. Like honestly, all the staff were super nice, and I know like we're in their way because they have small like nursing stations and they have their area pretty limited. We're not allowed to go into the room, so we're always hanging out by the nursing station, but then again we also have to be walking in the halls and going into the therapy rooms with the patients to be able to talk to them and get our clinical work in. And I know we were in their way, and I know we were kind of annoying because we do ask a lot of questions. I personally love to ask questions. I try to find like that one nurse that looks like she's the least bothered, or he looks like they are the least bothered by students, and I'll just be asking them like, what does DTS and DTO mean? Danger to self and danger to others, in case anybody doesn't know. But there was stuff in the charts that we really didn't know what the acronyms kind of stood for. Also, there's floor staff, and I think they're called licensed psychiatric techs, LPTs, and they were super awesome and hands-on with the patients, and I just really liked seeing their interactions with patients. Nothing like we expected. better than what we expected. It was more real, it was more raw, and at the end of the day, these patients are really going through something that's real to them, and it's real in their head. So it really gave me more of a respect for their illness, and so that was really, really neat. Week 2 rolled around, and everything was still going pretty smooth. That week kind of went by even faster than week 1 because we still didn't have any exams coming in, and we were just kind of getting prepped for our first exam. My professor did end up having a Q&A session, and she kind of went over the exam for it. Our first exam came by, and fortunately for us, our professor did give us access to the book's practice questions online. It's through a website called Lippincott. The book is a Lippincott or Walters Kubler type textbook, and so they have a bunch of practice questions for every chapter of their textbooks, and she gave us access to them for free, which was really incredible, and we did not expect that at all. So I was honestly taking a bunch of practice questions. So the way I studied was I read the chapters 2 times over. I wrote all my notes on the PowerPoints that were provided by the professor and the ones that she used for lecture, right? And then I had my notes from lecture, and then I wrote and did all of the questions that were available to us. I did the practice quizzes like maybe 8 to 10 times per chapter. There was 20 questions, and I would just keep doing it and keep doing it because every time I took a quiz, I did get different questions here and there, so I just kept doing the quizzes over and over again until I felt pretty comfortable with the rationales and getting into that style of thinking again. And so I took my exam. I didn't do as well as I was hoping. I still got a B, and so I was happy. I mean, at this point, some of the times you have to be okay with, as long as you pass with a good grade, you're solid. So we took our exam on Monday, September 10th. I passed it, and then we had to get in our ATI mode. So the way ATI works is, I know there's mixed reviews. People hate it, people love it. I'm indifferent. It's something I have to study for, something I have to know. And ATI has a different style of asking questions than my school does, and then my professors do, because they have their quiz bank and my professors have their quiz bank. And the information is not always 100% the same. Sometimes ATI may say this and this is the most important side effects to know about, like antipsychotics, and then my professor will say actually this and this are the most important side effects. So it's just, some of the information sometimes is kind of flustered and a little bit different. So when I'm studying ATI, I cannot be looking at my textbooks. I just have to learn the ATI textbook and do the practice questions on the ATI website, because if I try to incorporate studying through the textbook, I start getting confused and it's a little bit too much. So personally, I like to keep ATI week just solely ATI. We did take the exam this past Monday, and again, I did well. I passed with a level 2, which is what you need in my cohort, in my program. ATI is 20% of my grade in our program, and so you pass it, you're good, but it's not like it's gonna up your grade that much more. So as of now, I have an 86% in the class. Now we're in finals mode, and our final is 45 points, so it's almost half of our grade. So this past week, my professor said we were gonna get tested on everything. It was gonna be cumulative because it was a final. But she had also previously said that it was just going to be on the new chapters from weeks 3 and 4, because we were already tested on weeks 1 and 2. So we're all just going to know everything. We're going to be quizzed on, or tested on 8 different chapters of the textbook. We're tested on schizophrenia, anxiety, somatic disorders. There's also major depressive disorders and mood disorders, and then the medication and pharmacology of it all. Oh, and then the legal and ethical aspects of mental health. So far so good. I have made little like sayings for myself to remember and memorize my medications, so I feel pretty confident in my medications thus far. I still need to work on my side effects. I still need to work on fully understanding anxiety and schizophrenia, because those are the newer chapters. So that's all really that's been happening right now. Also, I donated blood and it infiltrated, and so it got a really like gross bruise, but I honestly think it looks kind of cool. But yeah, so this is something that I've been dealing with the past 2 weeks. I had to cover it up for clinical last Wednesday and this Wednesday, just because I don't know how the staff at the hospital or my professor are going to react to it, just because it's so big and it takes up a large area of my arm, and it was a lot darker than this. You have to cover all your bases sometimes, really, because you never know what they'll take the wrong way. So I was just always wearing a sweater. I decided to play it safe. So that's it for today. Okay, I'll try to check in next week for sure. Maybe.